Clinical case simulations for ninth semester. Clinical case simulations are a crucial aspect of medical education, aiming to bridge theoretical knowledge with practical application. Below is a detailed explanation of two main components: SOAP approach, subjective, objective, assessment, plan, and evidence-based literature review for patient problem solving. 1. Discussion of cases using the SOAP approach. The SOAP method is a structured framework for documenting and analyzing clinical cases. It helps students or practitioners assess and plan treatment logically and systematically, ensuring all aspects of patient care are addressed. 1.1. Subjective. S. Gathering patient history. The first step involves collecting information from the patient or their family. This includes the chief complaint and medical history, providing context to the symptoms experienced. Components of subjective data. Chief complaint, CC. The primary reason the patient seeks care, described in their own words. Example: I've been feeling short of breath for 2 days. History of present illness, HPI, a detailed description of symptoms, including onset, when the symptoms began, duration, how long they have lasted, location, where the symptoms are felt, if relevant, severity, mild, moderate, or severe, aggravating or alleviating factors, what worsens or relieves the symptoms. Example: for chest pain, it feels like heavy pressure, started 2 hours ago, and gets worse when I walk. Past medical history, PMH, chronic diseases, e.g., hypertension, diabetes. Previous surgeries or hospitalizations. Medications, current drugs, dosages, and patient adherence. Example: I take 5 milligrams of amlodipine daily for blood pressure. Allergies. Allergies to drugs, food, or environmental factors. Example: I'm allergic to penicillin. It causes a rash. Family history. FH, diseases with genetic predispositions or commonly occurring in the family, e.g., early heart attacks. Social history, SHISH. Lifestyle habits such as smoking, alcohol consumption, occupation, and social support. Review of systems, ROS. A system-by-system inquiry to uncover additional symptoms that the patient may not have reported. 1.2. Objective. O. Physical examination and diagnostic data. This step involves collecting measurable and observable data to supplement subjective information. Physical examination. Performed systematically to identify clinical signs supporting the diagnosis. General examination. Vital signs, blood pressure, heart rate, respiratory rate, body temperature. Inspection. Pallor. Cyanosis or jaundice. System-specific examination. Cardiovascular. Auscultation for murmurs or abnormal heart sounds, pulse palpation. Respiratory. Auscultation for wheezing or crackles. Abdomen. Palpation for tenderness or organ enlargement. Neurological. Reflex testing, motor strength assessment, and sensory examination. Diagnostic tests. Ordered based on clinical suspicion derived from subjective and physical findings. Examples: blood tests, CBC for infection, HbA1c for diabetes control. Imaging, chest X-ray for pneumonia, CT scan for stroke. Specialized tests, ECG for arrhythmias, spirometry for pulmonary disorders. 1.3. Assessment, A. Diagnosis and problem analysis. This step involves analyzing all gathered data to formulate a tentative or definitive diagnosis. Diagnosis formulation, based on subjective and objective data. The primary diagnosis is prioritized, and differential diagnoses are listed. Example: a patient with chest pain. The primary diagnosis is angina pectoris. With differential diagnoses including myocardial infarction or GERD. Pathophysiological correlation. Explaining the relationship between clinical findings and disease mechanisms. Example: in type 2 diabetes, insulin resistance leads to chronic hyperglycemia. 1.4. Plan, P. Management plan. The final step involves designing a treatment plan based on the diagnosis. Treatment plan. Pharmacological. Prescribing medications, including dosage and duration. Example: for hypertension, prescribe amlodipine 5 mg daily. Non-pharmacological. Non-drug interventions such as lifestyle changes. Example: educating the patient on a low-salt diet and regular exercise. Follow-up plan. Additional tests to confirm the diagnosis. Example: thyroid function tests for suspected hypothyroidism. Patient education. Explaining the diagnosis, treatment, and prognosis to the patient. 2. Evidence-based literature review for patient problem solving. 2.1. Using evidence-based medicine, EBM. EBM is a medical approach that integrates clinical expertise with the best available research evidence to guide clinical decision-making. 2.2. Steps in literature review. 1. Identify the problem. Formulate a clinical question based on the patient's case using the PICO framework: population, intervention, comparison, outcome. Example: is metformin, I, more effective than glimepiride, C, in controlling HbA1c? O, in patients with type 2 diabetes, P. 2. Search the literature. Use medical databases such as PubMed or Cochrane to find relevant journal articles. 3. Critically appraise the evidence. Assess the validity and applicability of research findings in a clinical context. 4. Apply the evidence. Incorporate research-based recommendations into the patient's treatment plan. Conclusion: the SOAP approach provides a systematic framework for analyzing cases, while evidence-based literature reviews ensure that the treatments given align with the latest standards in clinical practice.